What is up, y'all? Kevin Kuhn here from Athlete Factors. This is the Athlete Factors podcast. This is episode 105, I believe. My guest today is Dr. Jonathan Pearlman. How are we doing today?
Doing great. Thank you for having me.
Awesome. Thank you for coming. We've been able to kind of cross paths quite a few times via run-on and stuff like that. So, really excited to have this combo with you.
Yes, sir.
So, let's dive right in. So tell us a little bit about your background, academics, athletics, personal, as personal as you want to go into, and professionally what you're doing now.
Yeah, so we'll start off by, I am a doctor of chiropractic here in Richardson, a Gonstead doctor by trade, which we'll get into. So there's a very long story, which I'll give you maybe the medium version of this for your podcast and for your audience today, of how I decided that I was going to be a chiropractor and my athletic background and everything. And the thing that sticks out for me the most is, growing up, I was this very, very, very religious, very orthodox, observant Jewish kid in Providence, Rhode Island, from a family that you went to temple every morning once you turned 13 and you put the tefillin around your arm, and you were in temple on Friday night and Saturday. So that didn't leave any room for my passion, which was football. So it was all about football. I wanted to be...
No Friday night lights.
Yeah, no Friday night lights. That did not exist. I was in, junior high, and I wanted to play football, and I was very fortunate that I guess I was good enough at complaining at a young age that my dad let me play in the Pop Warner Leagues, and I would walk to the field, I believe, that was local enough, on Saturdays. And by the time I had gotten to high school, circumstances in the family, and my dad actually died young, and I was young. I was 15 at the time,
Wow.
15 and a half, and sort of broke that barrier of me not being able to play sports. And, my mother was like, what am I going to do? And I was like my outlet. So football was everything.
Yeah.
I ended up going to a small college called Nichols College in Dudley, Massachusetts, where I played, and I was a very petite linebacker. But because I didn't get the play that I felt I deserved, I started rebelling and thinking, school's not for me. And I, wandered on off into the abyss to phase out of football and to not do anything athletic for many, many years. That resurfaced in about 2009 or 10 when a chiropractor in Rhode Island, Doug DeCubellis, who I've called out many times on my channel, pretty much saved my life. Rid of back pain, if you will. I mean, I was so ridden with back pain, and that's just a whole other story in itself. And when I started getting more energy, I was able to start working out again. I started running again, and I always make the joke that, you're probably a runner. I run, but I'm not a runner. I'm not a runner. But that was sort of how I found my passion for exercise again, which then took me down the road of CrossFit. By about 2012, I was a very serious CrossFit athlete. And there was no doubt that I had the ability to do, especially the bodyweight stuff and the muscle ups and wall balls and handstand push-ups and things. I was very efficient, very good. And I basically broke my body, destroyed it over the course of a year. Led me back down the road to see just how amazing this chiropractor was at putting me back together. And really, at that point, I started to go back to school. I wanted to be a trainer. I went for exercise science. I was going to either be a physical therapist or a chiropractor. And it was chiropractic that inevitably, time and time again, would show me, especially the independence that we kind of have as portal of entry providers. A lot of people don't know that. You don't need a referral or a recommendation, whatever you want to say.
Yep.
And that's where chiropractic, it just I'll tell more stories without just rambling on for the first 40 minutes. But how I really got into chiropractic. But yeah, football was a thing, and then CrossFit, and I just found myself and said, I'm going to graduate, and I'm going to help people. And now I still do some of my running from time to time. That's how we met.
That's right. That's awesome. So, yeah, football and CrossFit, those are both very, very, highly damaging. Lots of either impact or... you got to apply a lot of force and absorb a lot of force in both of those. And so, that makes sense to me that, you're going to be drawn towards something that is a lot more the opposite of those things, like the like the healing side of of kind of what we do in the industry of XPhys or written, not just XPhys, but the human body in general. So that's pretty cool. So talk to us a little bit about your practice now.
So my practice now is, like I mentioned, this Gonstead system, or the Gonstead method of chiropractic. And I mean, it's really boutique. Like I see here in this office, which is very impressive, everybody. If you haven't been to this office, this is one awesome space, high ceilings, state-of-the-art workout equipment, and what you need to get, somebody who knows what they're doing to get you in shape to heal you of your what do we call those injuries.
Yeah.
So imbalances, we should say.
Imbalances works.
So my office is similar. It's like, we've got my office manager now is we've got a changing room in there, which is also an icing room, which it doubles as, because we treat a lot of acute patients. That's sort of where Gonstead, I guess you could say, is known to kind of be what I refer to as the gold standard of chiropractic. And that's not to take away from any other person practicing chiropractic. It's just the thorough analysis, the x-ray analysis that this guy, Clarence Gonstead, who started it, this is back in the 20s now, 1920s, and he developed this system that really took specificity to like a whole new level in chiropractic. And that is what I was drawn to, and that's how we practice at my office. So even if someone's not in acute pain and it's more of a wellness case, or if it's more of like a vertigo or a migraine case, as we're working on a ton of that now. Everyone knows about the term like COVID long hauler, but there's certainly the inflammatory component of it and the sinusitis component of people wearing masks for so long that are sensitive to these cotton fabrics, hands touching, bacteria getting trapped, and they're coming in with a ton of vertigo, a ton of migraines, and on top of helping out with lumbar disc patients and cervical disc patients and the radiculopathy cases. We work on that pretty much all day, every day, and it's very rewarding. Yeah.
Awesome. So I listen to quite a bit of Joe Rogan. Like I'm in the car a lot, or if I've got downtime, I'm listening to Joe Rogan or tons of other podcasts. But he loves to crap on chiropractic medicine. So.
Yeah.
And his go-to is always like, well, the founder was just making stuff up and was like, claimed that he received this information from another doctor who was dead, and so he was receiving it from, beyond the grave. And anyway, so that's kind of the interesting beginning, let's say, to chiropractic medicine, and that was D.D. Palmer. So where did his ideas end? And where does modern chiropractic medicine begin?
So I'll do my best to answer this, and I think I actually have a pretty good handle on it because I kind of practice in that realm of kind of old school vitalistic chiropractor, subluxation based. And subluxation, for all the listeners, when you hear chiropractic subluxation or vertebral subluxation or the word subluxation used by a chiropractor, that means not bone out of place, it just means pressure on a nerve. It means that it's bothering the neurology. Right? So it's different than like, hey, I got a tight muscle that I knew I hurt because I did a bicep curl and my tendon kind of, got a spasm, or the muscle belly got a tear. So that's what a subluxation is, pressure on nerve. Now, Joe Rogan, for all his woes and things that he says about chiropractors, I too listen to many of Joe Rogan podcasts. Yeah. And I can't even say that he's half wrong about a lot of the things he says. But my first podcast that I made right out of school was called Not the Problem with Chiropractors. Completely purposeful in a response to that podcast where Joe Rogan's saying, the problem with chiropractors, and it's all over YouTube. The thing is, there are people out there making false claims. I don't think that any D.D. Palmer, B.J. Palmer, vitalistic chiropractor really intends to do that. I think that at some point in school you kind of hit a fork in the road and you have a decision to make. And you're going to say, well, just how dogmatic am I going to be about what it is that I do? And how evidence-guided am I going to be? And we know we've all seen these, miracles, if you will. We can't really explain what's going on, and then you kind of meet in the middle and know enough or be humble enough to say, well, I don't know the answer to. So when it comes to D.D. Palmer and B.J. Palmer, that's the father and the son, the creator, the founder, and the developer of chiropractic, they're really focused on something that's called the big idea. I'm focused on the big idea. It's that chiropractic is not just for neck and back pain, but it's actually treating, we don't treat anything, we care for everything, but through removing nerve interference, the body is able to heal itself. And if the public kind of, I guess you understood that, or if, Western medicine or Joe Rogan or anyone else just kind of understood that we just want to remove the nerve interference and or pressure in that joint, and then the body can optimally heal, that's really where it ends. What's cool is that we both kind of probably do, and I'm going to finish the rest of that answer the rest of that question if you'll excuse me. But what we both do kind of where modern chiropractic or the new age paradigm of chiropractic kind of begins, that crossover, that fork in the road where it begins to go towards evidence guided. It means, sure, we're going to use some reciprocal inhibition on a muscle or a joint. Sure, we're going to go ahead and muscle test those abductors and then see if something on the adductor side is not firing. We're going to rip the psoas. We're going to activate the glutes. If someone's not doing that and their person isn't walking around, dare I say, healed, then they're missing something. However, I don't have to lie to myself or my patients or the public or any of the people that listen to this that, well, we're just going to remove the nerve interference and your body's going to heal itself. Because it does some of the time, to quote Reggie Gold, the famous chiropractic medicine practitioner philosopher, it does some of the time, but it doesn't all the time. And that right there, that some of the time, all the time, is where old school paradigm ends, D.D. Palmer, B.J. Palmer, and new paradigm begins, and we mesh. And if it really was to elaborate, insurance handcuffing chiropractors has really kind of taken the new age approach and made us TENS units, ice packs, heat packs, exercise, soft tissue, and it's made it kind of a problem.
Yeah, the stuff that you can bill for.
The stuff we can bill for,
yeah.
And I don't like that. I mean, but I will say, the big idea, neurological symptoms. Now, but again, if somebody goes out there and says, well, I'm going to heal your baby of colic or come to me for 65 visits and your tumors will reduce if you take the supplement, obviously that's the word dare I ever use, and I'm going to use it here just so people know how derogatory it is, but that's quackery. That's terrible. Nobody should ever do that.
Right.
But if somebody came to me and sought counsel in dietary or lifestyle changes, what vitamins should I or shouldn't I take, supplements? How many adjustments will it take, and will this affect said organ or muscle or gland system? We can have a very honest conversation, and I can say, well, you know what? That thoracic nerve, where you're feeling a lot of pressure, has the sympathetic ganglia that goes down to the liver. Why should I imagine that something that's keeping you biomechanically locked up, maybe where there's pressure in that joint, not be affecting the nerve that goes there? And miraculously watch them say, well, I haven't had that little pain and my digestion's been easier.
Yeah.
I mean, that's a thing.
Yeah, I think that's the really interesting thing, because I think there's a lot of perceived woo, like, because people don't understand anatomy. Like, when you, like, there were 2 anatomy classes where I went to undergrad. There was the anatomy class, like A&P, for the kids who were definitely not going to go into grad school and continue learning. And then there was the A&P class that everyone else took, which was in the nursing department. And in this class over here, they'd study the skeletal system and the muscular system, and that was basically it. Not a whole lot of nervous system, not a whole lot of digestive system, etc., the other systems of the body. So, like, if you only study the skeletal system and just the muscular system, you don't know innervation, you're only studying, origin, insertion, and action of the muscles, then you're not going to understand how a compressed thoracic spine or bad posture could lead to digestive issues because you don't know, like, oh, well, these nerves actually innervate this area and they also connect here, or they have effects downstream here. Like, so I think that's probably one of the biggest issues that I think I've seen with certain people being like my chiropractor is so good because like he just went pop, 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 and then all of a sudden I was healed of X, Y, and Z. And it's like, well, I know you think that's what happened, but like, here's actually what happened, and that's why you're feeling better. And I think there's a lot of that that's probably missing. But you know, it's just like.
And if I may.
Sure.
One of the things I actually almost left out through that whole spiel of mine was the principle, the rule, like structure dictates function. Mm-hmm. And we forget that, like that gets lost in the abyss at parts because someone will say like, oh, that chiropractor, don't go there, that's dangerous, or don't go there, that's not going to do anything. You're suffering with whatever balance issue. You're suffering with whatever digestive issue, frequent urination, indigestion, things like that. Mm-hmm. Again, there's something structural, and even if you thought about it from internally, like in the organ, we're not manipulating organs, although some people will say, we absolutely do, we manipulate the viscera. Sure, there's probably a hiatal hernia pull. There's probably a stomach, quick ninja strike that I'm not aware of. But when we adjust the joints that are sympathetically or parasympathetically bothered, right, no homeostasis at that moment, mm-hmm. that seem to be involved with the dysfunctional organ, it's pretty amazing how often some of these symptoms begin to lighten up and even resolve. Now, is it permanently fixed? No, people got to take medication for the rest of their life as well. Mm-hmm. But there is an attribute then of, and I think you alluded to it, of like just kind of stress, or that's not exactly what happened. Like there is definitely another component. There's a deeper underlying thing to kind of treat in there. Mm-hmm. But again, structure dictates function, and it can't be, I don't think, emphasized enough.
Yeah. I think like early on, my experience with chiropractic medicine was, my assumption was all they were focused on. So for those who can't see, I've got a poster over here of the skeletal system. I've got a poster over here of the muscular system so that I can point things out to my clients. My idea, ignorantly, was that chiros only focus on this. They don't even know that stuff. So like, if these things are like coming out of place, like just popping them back into place, obviously that's not going to stick because you've got all of these muscles which generate force and hold tension and are calibrated and controlled primarily by the nervous system. Like, my idea was like, well, duh, like obviously if you only focus on this, then things aren't going to work. So for those individuals who have a similar assumption, how would you educate them?
It's interesting. You really took me to a good place right now. I can really watch this. This is what we're going to do. In my office, I used to have the same poster of the skeletal system, the muscular system, and the nervous system. Mm. And all three of them are in there. I have smaller posters, and we would have them in the office. Yeah. And then many, us healthcare practitioners or manual therapy practitioners had these. Mm. Well, I threw out the skeletal one, and I kept the muscle and the nervous system one. Mm. Because for me, it's all about the nervous system. Yeah. And I don't tell any, I don't treat the nervous system. I don't treat anything. Mm-hmm. But I look for these subluxations and I adjust with, and now this is where it all makes sense. I respect and acknowledge when we talk about the muscular system, we talk about the skeletal system, because when I approach a subluxation or I approach an imbalanced body where there's pressure, I look for three things. I look for the rotation. I look for the lateral bending, and in that lateral bending, I'm respecting the fascial distortion. I'm respecting the muscle and the fascia on either side of the body, which one is stretched and which one is compressed. Mm-hmm. And then the third thing that I'm looking for, because as I wrap those two in there, right, is the swelling or edema, we call it in the Gonstead system. Mm-hmm. So I'm looking for rotation. I see the lateral wedging, and then I'm looking for this edema, because usually when we go at least from C2 down to the top of the sacrum. And some people in various segments of the sacrum, they'll have these discs, right? We know we have discs up until L5S1, some even a little lower. And what will happen is when they get stretched, and that stretch component happens, and those fibers begin to tear and aggravate that capsule and create an imbalance or a pressure gradient, right, anyways, with fluid in the air, or gas is a better way to say it, it's going to create some swelling and edema. And almost all the time, that edema is this great indicator of where that, forgive the expression, bone out of place is. And I make my adjustments according to the torque needed to respect the fascial distortion, take the rotation out depending on the vectors, and also try to see that edema reduce.
Gotcha. So let's go into a little bit deeper the differences between Gonstead and other chiropractic techniques. So, like, what are the major differences? Did you? Let's start there, and then I'll ask a follow-up question.
Well, it's a good place to kind of continue to elaborate on my approach, which that approach, talking about fascial distortion and just kind of like adding that on to the lateral bending and rotation and the edema, and how much flexion or extension does the joint have. That's kind of what makes Gonstead's system a little bit different than most chiropractors. The big thing, though, to take home is that, one, we're going to x-ray all of our patients unless it's clinically irrelevant, as opposed to being why only, or only x-ray if it's clinically relevant. We just want to have a blueprint and not be the person that's, thrusting away on a joint and just kind of miss something.
Yeah.
And if we see, like, a classic example would just be sacralization, lumbarization, where they're actually like fused, but you think you're adjusting an L5S1 joint, but it's not. Another one might be something like where an atlas might be unstable. That's a pretty big deal. So that's not even getting into, like, you know what I'm saying? And the reason I'm saying it like that is, like, that's not even getting into like pathology, like straight pathology.
Yeah.
Because if you're thrusting on hypermobile joints, then you're making them more hypermobile. You're bothering those ligaments. You're bothering those tendons.
Yep.
You're starting to piss off the disc fibers. They're gonna have a hard time.
Yeah.
And in the Gonstead system, not only do we want to be that thorough with the X-ray, and we want to know, the side that we're adjusting on. We want to respect which part of the cortex may be actually weak, which part of the cerebellum may be weak. When we talk about brain lesions, and again, you know these terms, we're not talking about like cancerous stuff. We're talking about like actual like imbalances people are suffering from. And if they went to a chiropractor who just laid them down, pressed a little bit, and said, "Oh, that's a little tight right there," and started going both sides of the neck, and started going both sides of the rib cage, and started going both sides of the hips, what are we doing? We're doctors. We're doctors of chiropractic, and we should respect ourselves as such, which kind of alludes me to, like, that's what the Gonstead thing to me. It's like, we're doctors. We stand in that office, we're going over x-rays with purpose. We're not just pointing the bones to make shit up. And if people believe that, I'm sorry for them that they think that.
Yeah.
There is a lot of, science, biomechanics, and neurology that goes into my report of findings in x-rays. So you're gonna come in and get your full spine film so you know what I'm talking about.
Yeah, I need this blueprint done, man.
And then we look at the skin on skin. So in other words, men and or women or everyone will gown. Sometimes a man might say, "Oh, I'll take my shirt off, doc, fine." But we're checking the the quality of the skin, again, for that edema. But I mean, again, we're doctors. The other day, my mentor in Rockwall, Dr. David Waller, great practitioner, been doing it for over 20 years. He sees that someone has something that looks like a melanoma. Same one that killed Bob Marley, right, on his toe. But he had it on his shoulder. He goes to the dermatologist, sure enough, malignant melanoma.
Wow.
And he caught it. Why? Because he's doing skin-on-skin chiropractic. And then, like, also without getting like further braggadocious, or maybe a chiropractor listens to this and gets offended, and guys, it's not what I'm doing here. I mean, I always in school was stuck on what they call the Gonstead seated cervical, and you might have seen on my Instagram, that I do all these like seated chair adjustments. We try to be, super specific and really only affect that disc level we're working on, or upper cervical. And the thing I was able to do from an early age, I didn't even like consider this, was when somebody in a wheelchair came in and they were like, "Hey doc, I need an adjustment." And it was like, "Well, I'm bound to this wheelchair and my neck's killing me." Well, man, was that convenient that I could actually move that joint and give him the pressure release and relief there from him just sitting in a chair, rather than saying, "Well, I didn't practice enough Gonstead when I was in school."
Yeah.
And I mean,
Wow.
Yeah, there's all these reasons why I love doing Gonstead compared to going to the joint down the street for $39 crack.
Oh man. So
Whoops.
no, that was perfect because that allows me to segue into when I was in college. I injured my back. I went from being 4th in the nation in steeplechase my sophomore year to then hurting my back really bad. It wasn't like I wasn't messing around. I was cleaning up after a meet and picked up a set of bleachers and I was fine, and picked up another set and I was fine. Like they're small and I'd lift them up and somebody would slide a dolly underneath. Last set of bleachers, I didn't know how to lift weights at this point. Like I wasn't doing any strength training, and so I'm sure it looked hideous, and I just went, huh? And I saw stars, and I was like, oh no, this isn't good. And then about 5 minutes later, like I couldn't walk. I was like, this is awful. This hurts really bad. And the school athletic trainers, like, they did their best, but they were, in my opinion, trying to treat the symptom and not the dysfunction, and wasn't really getting any better. And my mom was like, well, there's a chiropractor in town, let's see what he can do. And I'd show up and like lay on the table and pop, snap, and I'd be like, oh, that feels different. And then half an hour later, I'd be like, it feels exactly the same as it did before. It might even feel worse now. Like, I don't know, but...
Oh, Kevin, you had the opposite of a chiropractic miracle.
I had no
idea. At the time you needed it the most. Yeah.
And what's crazy is, like, the next 2 years were really, really depressing from an athletic standpoint. Like, I wasn't like, oh, my life is over. Like, I was fine. In fact, that's why I do what I do now. Like, that put me in the mental state where I was like, okay, I'm not going to allow any of my athletes to have the same experience that I did. So I need to understand better than anyone else who's dealing with these athletes how to train them so that they don't get injured, how to maintain like nutrition and how to coach them on nutrition, how to do sport performance so that they're getting better. So I was trying to be everything. I was trying to cover every single circle that overlapped with running. And that's essentially why I do what I do now. But
3 things stick out to me.
Go ahead.
One is you got hurt when you were fatigued at the last set of picking up these bleachers, wobbling all over the place. That's the way I envision it. I just picture a young Kevin picking his thing, wobbling everywhere. You got your arms out, stretched, bending, rotating.
They were like 3 levels of seats, maybe 4. And so it was literally all I had to do was pick it up like 4 inches off the ground, and somebody would slide a dolly underneath, and then I'd go around to the other side, do the same thing. And it was just like, I was probably just hunched over, I can't imagine. I'm sure it was ugly though.
The other thing that sticks out is that you went to a chiropractor, it pop, snap, click, but you felt, not only did you not feel better, but you felt worse.
Yeah.
Which again highlights why I do Gonstead work and why I hope that people really thoroughly, even if they're not doing Gonstead, they've got to be more specific. Because one of the things that I see, and I learned this very early on because I was practicing Gonstead, because people were coming to me because of the YouTube channel, because they were coming to me because they were acute, locked back, life ruined, my disc blew out, I have pain going down to my toe, and I learned that you've got to know which discs, or excuse me, I say disc, but which segments not to adjust. And if someone maybe missed the fact that you might have had like a lower sacral segment kind of blow out, but they couldn't get that low, or maybe your thoracolumbar junction just all of a sudden, boom, snap, lock down those QL muscles, and that was actually the issue. And your lumbar is actually sustained well, but they didn't have the right table or the right technique to actually treat you. That's just how specific chiropractic needs to be. And God, if there was a third thing that stuck out past the form and fatigue, I already forgot it.
No worries. Yeah, I think basically what happened was I said, my back hurts. I heard it lifting some stuff. And he was like, all right, well, let's start popping your back. And yeah, it was, like I said, it was like 2 years that was not great.
Okay, that was my question. What inevitably helped you the most while your back was not great to actually becoming great, or is it still just not great?
No, it's fantastic now.
Okay.
But it was studying posture, specifically Yanda's upper cross and lower cross syndrome, and figuring out I'm stuck in this excessive anterior pelvic tilt, and as soon as I released my hip flexors, stretched them out, turned on my glutes, retrained my diaphragm because I didn't know how to breathe. Like, man, I remember one time standing in my kitchen and just trying to the technique is called like breathing behind the shield, like where you're bracing, right? So you're squeezing your glutes, squeezing your abs, and then forcing your diaphragm to push against your abdominal wall. And I felt they weren't like pops, but it felt like all of a sudden something was different, and I was like, oh my goodness, I need to continue doing this. And then, here we are 12 plus years later, and like I'm running now the way I wish I was able to train my senior year of college.
Okay.
So but it took me a long time to figure that out because I had to, it's funny how, in general, chiros tend to have their set of blinders, physical therapists have their set of blinders, kinesiologists set of blinders, orthos, everybody has the access to the same science, we're looking at the same bodies, but we all kind of have this is the technique or this is the way it should be done. And the nice thing is we can have these conversations and we're using the same language. We've got the same terminology, we've got the same words that we both understand, which is really nice. But there's oftentimes oh, you're a chiro? Oh, okay. I'm just gonna talk to my people over here, and we're on this team, and you're that team, and you don't know what you're doing because we solve these problems using this technique, and even if you do solve the same problem, you're using a different technique, and ours is better. So there tends to be so much of that. So what ended up helping me was learning techniques from different professions and figuring out okay, so this is what's supposed to work for me based off what I've learned as an exercise physiology student. But if I use this physical therapy assessment, I can figure out what's wrong. And then if I, I've read a lot of massage therapy, technique books or soft tissue work. And so I'm like, oh, okay, well, if I get this muscle to relax, then I can then incorporate this sport performance technique and this exercise and this stretch, and I'm correcting things. You can manipulate the nervous system in real time. That's amazing. So that's, long story short, I had to figure out these steps along the way, and then coming here to Dallas, working with my mentor, Ambrose Coleman, he basically was like, dude, here's how you do it. And I'm like, oh my goodness, well, why didn't they teach me this?
But it's amazing what they don't teach you in school.
Yeah, but it's partly because he was put in a position where he was overseeing a clinic that was half physical therapy, half chiropractic, and he was able to oh, you know what, I'm going to use this one from this side to fix this client or fix this patient, and then oh, that's not working? Okay, I'm gonna use this one from over here. And he's like, instead of those blinders, he's like, no blinders, I'm just gonna use all of this, and whatever works, I'm gonna stick with that, and I'm gonna continue to use that.
Well, and I'm happy you said that too, because one of the proudest moments of my very young career as a healthcare practitioner was realizing that I'm not going to be able to save everyone. I'm not going to be able to fix everyone. And certainly, as you know very well, my technique specifically that I do might not even be effective for that person at that time.
Mm-hmm.
And I think, like you were saying, those chiros, they don't know what they're doing, and they can fix everything. And like, the orthopedic guy, well, if injections and the steroid round and then surgery.
Yep.
Or, we're going to muscle test and we're going to turn that baby on and you're going to be right as rain.
Yeah.
Once we kind of get stuck on that and we're not thinking, and we don't accept that there's going to be the ones that we can't treat with our technique, we're in a bad place. And
yeah, there's limitations to every quote unquote profession, and like this is always a tough one for me because I tend to struggle a little bit with pride. Like, man, I can fix anybody. No, I can't. But like, I'll always let you know if I'm like, you know what, we're not making progress. It's time to outsource to somebody else. You got to go see my guy Ambrose. He'll tell you whether you need surgery or not. Or he'll tell you like, you know what, it's time for you to go see this person. Or like, you got to have that network where you can be like, I feel I won't be able to sleep at night if I just keep taking your money and we're not making any change here. Like, and I think that builds so much trust. Like, I get referrals from people that I've said, hey, I can't take care of this. You got to go see this guy. And then that person's like, wow, I really appreciate that. I'm going to tell everyone about you. And I'm like, I didn't even fix you. Like, but it's one of those things. So, so part of what I do, almost exclusively what I do is work with athletes. So when it comes to what you do, how much of your practice is specifically geared towards athletes, and when is it appropriate for an athlete to come see you?
So, I mean, it's kind of funny, right? The obvious, answer for me, right? Like any chiro is going to be like, anybody, any age can come see me. And if they have an ache or a pain or an ailment, they should come see me. They should get their nervous system checked because their spine, right, is like where it all begins. Like through the brain and the spinal cord is where it begins. Mm-hmm. Now, that being said, I mean, off the top of my head, there's a few volleyball players, a few runners, a few, yogis that do come to the clinic often to get adjusted. They feel a lot better. Mm-hmm. And then along with their stretching routine or their core stabilization or their weight training, they go back to doing what they do. But recently, I referred a runner, like a real runner to you, who had bilateral proximal hamstring tendonitis. The reason that I would say that I wouldn't treat somebody, and this is where I'm going with this, is who I wouldn't treat, because I'll treat anyone, and I'm going to do what I do, remove that nervous interference, and give them good advice. But who I don't treat is somebody that I think has something going for them that's so important that they are reluctant to even receive an adjustment. Like, is this gonna mess me up? Is there a chance I get sore from this? I can't have my gait, I can't have my steps, I can't have my reaching. If I'm going bow hunting, whatever it is. Yeah. And I'm going to say, you know something? If you're that reluctant, if there's a chance that you leave here and something else kind of subluxates, we call it subluxation patterns in my office, and I mean my mentor in Rhode Island talks about this patterns, and I see this all the time. And I can most definitely say that I can, given enough adjustments, and for me it's like 6 or 8 adjustments, over the course of like watching a pattern develop, it's amazing the results, what we will get. People will really feel a lot better. But man, those first 2 adjustments, I'm sore where I never felt it before. So like I was saying, I mean, I might not work with that person. And if I've got a parent of an athlete that they're that reluctant, I'm going to say I'm not the guy for you. If there's an athlete who, got someone's, on his way to the Boston Marathon, I'm not pushing on that spine. Yeah. He's not in back pain. I'm not aggravating at his fiber. Yeah. He needs his tendonitis. He needs his glutes worked on. He needs whatever else he needs. Yeah. But because like if an athlete came to me, because really what I do in my office really well, really efficient, other than the acute pain. And that's the thing. Someone might see me one time to get out of acute pain, and then work with somebody like you to activate what need activation. Where I'm going with this is, radiculopathy in those referral patients. Like if they have any referral pattern that's clearly through ortho and neurologic examination, can say, well, there's a radicular pain from this nerve. There's a radicular pain from this nerve, and it's coming from your back or neck. I mean, that's me all day. So if there's a kid out there that got a stinger, I know maybe a head-on collision type of thing, and thank God, you know, he's doing okay, but he's got something here. I mean, that person needs to get in my office.
Gotcha. Yeah, that's one of the things that you keep mentioning is my mentor here, my mentor there.
Yeah.
Like, I love that. Like, I think most people, like, you have your own practice. I have my own practice.
Yeah.
I don't have a boss. But, like, I'm not done learning, and there's tons of times where I'm, like, scratching my head because I'm like, I have to, like, tell this person, like, I don't have an answer for this specific problem right now, but, like, I'm going to find it. And if I can't, then I know somebody who can. Like, being in a place where you can call somebody like, hey, man, what do I do? What would you do in this instance? Here's all the variables, you know, what would you do? Like, having access to that, I think, is really important. And, I feel like I talk about Ambrose all the time, and, like, almost all my clients have seen him either here, like he's come here, or they've gone up to his place up in Farmersville, and, like, they're still my clients. Like, they come back to me, and that's the other thing, man. Like, so many people are afraid to refer out other people that I trained with when I was working at, like, Gold's Gym or LA Fitness or something like that early on in my career. They didn't want to recommend their clients go to a chiro exactly, or go to a PT, or like, no, I'll take care of it. We'll train around that knee pain today. We won't address it. We'll just do upper body today, because they were afraid as soon as they send their client away, they wouldn't come back. I'm like, man, your client's gonna love feeling pain-free, and then they're gonna come back to you if you do your job, if you're good at what you do. So, I just went on a little bit of a tangent there, but
and you know, the best teachers are students for life. I'm sure Abe Lincoln said that or something, but I mean, it's a fact. And I'll tell you recently, and this is the problem. Some chiropractors in our profession, it sort of pays to be high volume. And the problem is as I've gotten busier, great, it's awesome. You know, it's a little easier to pay bills. Fine. You know, got a new puppy.
Yeah.
But the thing is, it'll take away a little bit of that extra time you used to have to kind of study and look forward to being able to learn something every day. And it really puts that little extra pressure. It's like, hey, you know, doc, stay on it, right? It's like, Yoni, stay on it. Study every day. Learn a little something every week, whatever. Because we want to constantly be evolving, constantly learning.
You got to schedule that time. Yeah. It's like, for me, it's the same with training. Like, if I wait till the end of the day to run or to lift, it's probably not going to happen. Like, I've got to cut out time in the day to study and to work out and to, like, to continue to sharpen my trade, sharpen my skill set. It's nice when you've got a full schedule, but, like, you can get burned out and feel bland, like, just feel dull. Just, all right, apparently now I'm an assembly line worker. Next, like, let's go, roll them through. Like, the money's nice though, but.
No, I always say this to my wife. In the words of Al Pacino from Carlito's Way, I always say, "Never me." So I mean, I stay present time conscious. I mean, my whole focus when I'm in front, just like you, I'm sure, it's like, that's my patient. Like, I'm going to take care of you. You know. What's interesting is though, I don't run as much. I may have said that I was going to train the puppy when I get home. Still get home, you know, sometimes 7, sometimes 7:45, but I might not train the puppy. That's where the burnout happens for me. Because I made that commitment very early on, and this isn't a disclaimer for the listeners. This is real talk, and this is where I actually do have. This is where my pride shines through, and now I just want to say it because we're going down that road. It's like trimester 1 of chiropractic school. This doctor named Gene Giggleman. He's a vet, and he's also a animal chiropractor, and somehow they merged that. And the guy was amazing, like a wizard. I mean, he knew the anatomy, trains anatomy, grades, and you name it, a guy in physiology, like the back of his hand. He's a genius. He said, for those of you who don't realize what you're doing here, you're playing with people's lives. They're trusting you with their lives. You're not just cracking bones or whatever. He said, if you don't want to be, can I cuss on this?
Of course.
If you don't want to be the doctor, then get the fuck out of the way. And I was like, boom.
All right.
So I take that with me to the office because it says, if I'm burnt out, if I got things going on, if I'm stressed, if I'm not feeling well, I better, if I'm there, it's going to be present time conscious. Because yes, and that's the thing, I've never wanted to become, and it never will be an assembly line. The thing will be, how much evolution can I do during my time as in a life of being a student to never be able, or will I be one day in the position that's going to be like, I'm sorry, I can't even assess you. Like, I can't even assess you, which is fine. But imagine being like at that point where you're like, I can't even assess the situation, honestly, I'm not going to know what to do. It's just not in my wheelhouse. I wasn't able to read up on it enough or something. That's kind of my fear. Yeah.
That's a good fear.
Yeah.
That's like, rewards are like really good motivation, but like also fears are very potent motivation. I think it's good to have both. Like you want to have an idea in your head of like what's the ideal? What's quote unquote heaven on earth look like? Like how do I work towards that? But then also like, okay, what could hell be like on earth? I want to get as far away from that as possible.
Yeah.
And like keeping both of those in your mind at the same time, I think is a really good way to stay sharp, to make sure you're providing the best service for your client. Like it's key. So, all right, let's shift a little bit. So, tell us a little bit about the keto chiro. Where did that come from?
Yeah, what's amazing is that when I first hashtagged it, I was the only one on the internet. Hashtag the keto chiro. I'm like, whoa, I got my own hashtag. So, and it was like at the time, I mean, look, I'm getting to the end of chiropractic school and I'm just putting on weight. Like, I mean, if I look at a muffin, I'm the guy that puts on 5-6 pounds of water weight and my glucose goes through the roof. Look, true story. It was getting, whatever bad, and one day I'm just looking at myself, I'm like, boy, I'm getting heavy again. But it wasn't just that. At the same time, I was having that pre-diabetic or diabetic-like symptoms, like going to the restroom all the time. I was actually having blurry vision driving.
Wow.
And this was like getting scary.
Yeah.
I'm like, oh boy, I better get a handle on this. So at the time, I had pretty much become educated enough to understand the biochemistry on a solid enough foundational level, if you will, to say, okay, this is how being in ketosis will work. This is how I'm going to lose weight. This is how I'll stop holding on to all this insulin in my body. And let's give it a shot. Well, over the course of like 3 months, my life completely changed. I went from like a very chunky, depressed looking, almost blind, that's an exaggeration, 185 pound, guy to like 165 pounds running every day, having just boundless amounts of energy. The driving stuff went away, the urination stuff pretty much went away. And when I say pretty much, I'll get to that. And I mean, I was like a changed man, and everything was like, I became an evangelist, like keto, keto, keto. It's the greatest thing for human beings in the history of the world. Now, interestingly, I was smart enough to do it the right way. So my version of keto looks like tons of greens, tons of nuts and seeds, very little protein, as in like, your 3 to 4 ounces, not signaling this whole, mTOR kind of worrisome, man would have all this gluconeogenesis going on.
Right.
Although, as a disclaimer, I want to put it out there right now that we should all know that all these things we talk about, making potential, or ketones being made, gluconeogenesis, all this stuff, like it's all happening at the same time, constantly.
Right.
But I had it like down to a science. I was measuring my blood ketones from like 0.5 to between 1, like all the time. If I needed extra carbs for energy, because eventually I was plateauing and I was getting very tired in the morning. But I was a whole shredded keto evangelist machine. And what happened was about 6 months into it, I began to get really terrible right quadrant pain, along with, again, this like, not really frequent urination, but I could never empty. And it was becoming like this increasingly vulnerable new kind of thing. And then I had gotten some more blood work done. My creatinine was quite high. My cortisol levels looked like they weren't desirable at the time. And they said, you're really dehydrated. You really need to, take better care of yourself and get some electrolytes. Now, of course, some of those doctors are like, oh, keto's dangerous. But at the same time, I just kind of turned it more into a paleo diet, and boom, I had it under control. And I still believe to this day, people like me, as in like my resting glucose, even when I'm per se in shape and not snacking on muffins, is probably about a 93 to a 98. But I can stay stable throughout the day, even having things that are high in glucose. Because I wore a glucose monitor recently, you might have seen it on my channel.
I did, yeah.
And like that was a great test. I know what does and doesn't bother me. And even though we're all different, I do want to say as a hard and fast rule, I think that just really refined and processed foods, forget carbs, just refined processed foods, I mean, people shouldn't be eating it, period. There's no need for it. The only people that, in my opinion, get the pass are tremendous distance, I call them, or like elite aerobic training athletes, if you will. That's where I was going with that.
Yeah.
Because they have to. They have no choice but to replenish not just glucose stores.
Gotta get those calories.
Gotta get the calories, gotta get the electrolytes. You just have to.
Yep.
Outside of that, though, I now know how to manage my ketogenic diet better. I am still an evangelist, so because I think that for me, eating like small amounts of protein, good fats from coconuts and avocados, all the ones we know, and I'm sure you've had on your channel a million times, and I talked about it to death on mine, and I still will. That's what people need to do. And I mean, if I could just live that way and not be a glutton for punishment and want to drink beer and have pizza on the weekend and just completely, ruin my body, then I'd probably be fine with it. But that was, what's amazing to me is how long I tried to out-train a bad diet. How long I just said, like, well, a burrito is healthy. Like, for who? How long I sat there.
In what context? Yeah. What is healthy?
Like cheat meals consistently, like, oh, it's no big deal because I went for my run, I earned it. I used to say, like, earn your calories, man. That's out the window now because, again, earn your calories. I mean, are you going 5 miles a day, every day, 8-mile pace, sweating up? Forget the sweat, but just some people sweat, some people don't. Are you doing HIIT workouts? I mean, are you really in that training zone where you can justify needing to eat that amount of food?
Yeah.
That's not the average American.
Right.
That wasn't me.
Yeah, there's only a few of those. There's only a handful of people who are genuinely fit in that description. That's one of those things. It's
that's really like how I became the keto chiro. And
I like it.
I still I think it's great. I probably eat fat as really just a majority of my diet. It's pretty bland, it's pretty boring.
Yeah.
But for me, it's the way that I can feel the best, the most often, and have control over things, rather than, I just took the cards I was dealt. And whether I did it to myself over time, who knows? But then I had way more GI issues before I ever knew the ketogenic diet was a thing.
Yeah, I think one of the things that I find really interesting is, like, I'm a sport nutritionist, so I'm always looking at the lens of nutrition, or through nutrition via the lens of sport performance and improving body comp and behavioral change, and all of that's like long term. Like, this was one of the things when you were talking about, the potential client who's like, hey, is this gonna make me sore because I've got this thing coming up? You're looking at things like, long term, here's what I want to do for you. And they're thinking short term, like, I don't want to be sore.
Yeah.
Right? So when I'm looking into dietary modification, it's almost always long term. I don't care what kind of diet, like, I've got clients who I work with who eat vegan. I've got clients who are keto. I've got clients who do paleo. I've got clients who just basically it's if it fits your macros, it's just, at the end of the day, everything will work if you can maintain it long term. And so when somebody comes to me and they say, hey, I want to try keto, and I'm like, all right, can you see yourself doing it 6 months from now? And they're like, no. And I'm like, then we're not going to go down that road because it's not going to be helpful. You like carbs, don't you? I'm like, oh, I love carbs. I'm like, let's not set you up for failure. Like, what can you do? Like, being in a calorie deficit is going to be really helpful for you. How we get you into a calorie deficit is less important to me. Some people are like, you know, I think I'd like to try keto, and I'm like, all right, are you going to be okay with no carbs? And they're like, yeah, I think I'd be okay. You still want to be doing this 6 months from now, 2 years from now, 5 years from now? Yeah, I think I can do that. Then that's the client that, you know, like, all right, well then let's give it a try and let's prepare for, you know, there's going to be trade-offs, right? These are all tools, right? But if this tool doesn't work, then we're not going to stay with it. Because there's not going to be success there. Let's figure out what's going to work well for you. Yeah, so I tend to look at things nutritionally from that perspective. Like, they're all available to me, but I try not to. I'm a little biased when it comes to like, what's your calorie needs? Then let's set you up on lots of protein, and then I want at least 30% of your total calories coming from high quality sources of fat. With whatever's left, let's do carbs. Let's start there, and if something's not working, we'll make adjustments. I've got one client up in Chicago. He's like, I love fat. I'm like, all right, let's drop the carbohydrates down. Let's ramp those fat numbers up, and like, he is having tons of success doing things that way. And I've got other people who are like, I've got a guy who he's had testicular cancer, and so it's a little tricky with him because like he doesn't produce testosterone, and he's like, fat, I don't really care about fat, like none of my hormones work anyway, so it's not like I need this cholesterol backbone. And so I'm like, well, even in that case, like there's a certain level that I'm like, I'm not willing to go below here, because once we get into this point, like this is beyond my scope of practice as a sport nutritionist. Now you need a dietitian. Now you need to, like, we need to outsource that to someone else. And he's like, okay, well, we can keep it there. So, but yeah, as long as I can make some long-term behavioral modification, like that's what I tend to look for. Sometimes that's with keto, and that's great. I went up to Colorado like 2 weeks ago. I'm pretty sure I was keto almost the entire time I was there, because I was like basically just eating bacon for breakfast, like 6 or 8 pieces of bacon, and then we'd get on the road. I was eating a lot of fat. It was pretty awesome. I enjoyed it. But like,
when you were running, did you feel your body in ketosis?
No, I did not. I did not. But I didn't have that. What do they call that?
Keto Flu?
No, I didn't have that. What's the ketone breath?
Oh, yeah.
Yeah, I didn't have any of that.
No, let me tell you, people that are deep in ketosis, and I had 2 particular people come to mind, but yeah, it's there.
It's a thing. Yeah, it's interesting, for sure. So, but no, I love talking nutrition. I love like being able to get into like, there's so many people who are like, their Instagram handle is the keto whatever, and I'm like, they don't know anything about it. They don't know this stuff. Like, they don't know the biochemistry of what's happening. So like, I really appreciate like what you did with the glucose monitor. I thought that was super cool, where you're just like updating, a little video every couple days or every day or whatever. Just here's my blood sugar.
I mean,
yada yada yada.
That means so much to me to hear, because here's the thing: there's so many people out there suffering, and like now this avenue exists. And for me, I'm embarrassed that it took me that long to do that for myself. It's time commitment. It's a little bit of money. It's not that bad, but I mean, it's a little bit of money commitment. And one of the things is, what I was going to say is, when it comes to the keto diet, or in particular, even I say carnivore, and I know Paul Saladino and animal-based now is like a big deal. But what I want to say is, I think there are people it's a small group. It's not, half the population, but it's a small one. Where we are, like as an in this, where we're forced to make these really drastic dietary choices. That becomes our only sustainable, diet and habits. It's a little unfortunate because yes, we're so driven to like be these like social creatures that interact with alcohol and food, and restaurants are not using things that I will tolerate well.
Yeah.
But that being said, like people who come to you are like, hey, I'm thinking about doing keto, and you already know this, so we're just kind of like beating the horse now a little bit. Is if it's not that they're going to be forced into that, they're really going down a road that they really don't need to be going down. Because doing something like switching to a ketogenic diet for them for whatever reason they're thinking about doing, even if they could lose weight by just being in a caloric deficit, they're going to really hurt their metabolism and their GI and everything else they got going on when they try to come back and be like, well, I tried keto or whatever. It's like you're setting yourself up for about a disaster. And I'm actually, what would be really cool is if you came on my podcast and we really dove deep into that too, just spitballing.
Heck yeah.
Because
let's make it happen.
Because that was like a really big thing for me. And I warn people like crazy. I'm like, hey, you saw me at those times and I was so lean and I'm posting every day and I'm like keto, 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 and I'm posting all my shakes and my meals. Yeah. Let me tell you something. If you're not ready for that to be like sustainable life, and like I had to do it, I have to. Current day, I don't eat the amount of fat that I did, and I don't focus like as much on that now. It's more about maintaining a balance of fatty meat with starchy carbs. But man, that's the thing that I learned, thank God, early, was like, hey, be careful with that. It's not because the keto diet is dangerous, it's what happens when you try to bounce back on something else.
That's it, man. And it's like that with figure competitors. Yeah. Like, if you don't, like, they do this step down calorie deficit, and then as soon as their show is done, they go ham. Yeah. Like, and that really, really messes up your metabolism. It doesn't matter if you're eating quote unquote clean. Like, if you go from a huge calorie deficit to then all of a sudden this huge calorie surplus, it could be the healthiest food in the world. Doesn't matter. Your body's not prepared for that. You've upregulated all your hormones that are going to store fat. You've caused so much like localized stress, and your gut was going to be inflamed. Like, you just messed everything up. So yeah, it doesn't matter if, like, everything works, but you still have to be able to, it works if you maintain it. Like, so no, I think you're exactly right with that. Like, that's why when athletes specifically come to me, like, so I follow a lot of, when it comes to ketogenic diet, I read a lot of Dom D'Agostino.
I know the name. I've heard him on social media.
Yeah, so he's doing a ton of research on ketones, on the ketogenic diet. Like, he was on Joe Rogan with Lane Norton, and they were basically coming at, it was kind of a debate, but they're both legitimate scientists and they're friends. And so, like, Dom's like, it's super interesting podcast. I highly recommend it, just because they're both, like, nobody's trying to pull a fast one on the other. Like, they're very honest about the pros and cons and limitations and trade-offs of everything. It's like, well, this will work here in this specific case, and here's why, and here's when it won't work, all that. And kind of just lost my train of thought. Anyway.
No one's trying to pull a fast one on Rogan.
Yeah, well, people try to pull fast ones on him all the time, I think. Maybe they don't know it, but where was I going with that? Oh well, moving on. No. Oh, so like, I like learning from him because he's coming at it from the perspective of he knows a little bit more about the sport performance side of things. And so if you're an elite athlete, like, so in ultra running, in triathlon, especially the longer triathlons, half Ironman and full Ironman, there's like a huge surge within the past 10 years to like, oh, you want to be fat adapted. Because then you don't have to worry as much about fueling during the bike and during the run, which potentially reduces any sort of gut issues. Like you're not gonna poop your pants in the middle of the run, which is that's a good thing. You don't want to do that. So like if you ingest a ton of carbs, like, and it's all in gel, like sometimes that flushes everything out and then you're in big trouble. So so there's this huge surge in like, you know what, everybody should be keto. It's like, yeah, but the best athletes aren't always keto. There's some that are. And oftentimes the reason why is because they found it super sustainable to their lifestyle. But then there's plenty of other people who are just as fast to eat a ton of carbs and who aren't keto at all. So when an athlete comes to me and says, hey, should I do this? Like that whole 6-month thing that I usually ask them, like, can you see yourself doing this in 6 months? It's because there's a lot of research on the performance adaptations to the ketogenic diet that don't show up until you've been consistent on it for that amount of time. Some of these adaptations, performance adaptations, don't show up for years, a year or two. So for those who are interested in doing it, I say, think about that time frame. And for those types of athletes, oftentimes they're thinking a year in advance, 2 years in advance. I want to compete in Kona in 3 years from now, or I want to do this race in a year from now. So like it's not the average person who's like, oh, I don't even know what I'm going to do next weekend. Like oftentimes these athletes are planning things out. But if you're in that mindset or frame of mind, like I think, yeah, if you want to do it and that's the timeline that you're going to work towards, sure, go ahead. But yeah, if you're like 3 months max and then I'm done, I just want to lose a couple pounds and I think keto will help me. Well, like you're going to lose weight really quick if you cut out all the carbs, because now you're storing less glycogen, and which means you're storing less water, and so you're going to lose weight really quick. But then you haven't lost any fat, so that takes time. That takes a calorie deficit. It doesn't matter what type of diet you're on. You've got to be in a deficit. So, but yeah, now I'm kind of combining body comp and sport performance. I'm pretty bad at that. I tend to overlap those all the time. So,
they're related.
I think so. So, let's see here. Okay, so this is the question. How does the layperson evaluate whether their chiro or a potential chiro is a quack? How do they know if they're legit? Like, is there a checklist of this, this, and this? And the reason I ask that is because one of my first guests I had on was a physical therapist. And he and I went to undergrad together. And I was like, Wade, how do you pick a physical therapist? And he said, if the physical therapist doesn't have a barbell and some serious weights, if they only have like some bands and like 5-pound weights, like get the heck out of there. They're not going to get an athlete back to the point where they need to be cleared. So I've tried to like ask that question to practitioners, like, how do you evaluate the quality of another practitioner?
So let's assume that this is not an athlete, right? So just a person, of any kind of person. How do they evaluate whether or not they're going to the right chiropractor, if they're going to do them wrong? And for me, it's really like the answer really is like it depends. And I always actually say this. Actually, now you brought up something that I used to say on my podcast, which was always try to find a recommended, like through a friend. Inevitably, most people go like through a channel, through someone they know.
Referrals are super powerful.
And you hope that the person that is giving the referral is competent in their recommendation. And if I then had to go more towards like my bias and my experience, I would say you're gonna have to give the chiropractor that you go to a chance. In other words, like unless they're just off the walls and you're just not feeling comfortable, then get out of the office. But if they've made you feel comfortable and they kind of explain things, how they're going to do the adjustments, how the procedure is going to go down in there, and you feel comfortable about it, you're going to have to give them a chance. If you like the way the adjustments felt, it's probably in a good spot.
Mm-hmm.
If you feel better getting off the table if you're in pain, which is most likely the case, then you're probably in a good place.
Mm-hmm.
And I would say that, build a rapport and see that this person is doing that service for you. That's really the best I could say, because, when it comes to the whole x-ray thing and the palpation and the this and the knowledge and what posters are on the wall, or, a barbell in the office or ice packs versus non.
Yep.
I don't really think that matters, but what I think that matters is if they're vibing with you and you're vibing with them and there's a good thing going on and you give them a chance and it comes down and you trust them and they adjust you and you feel good and you get off that table and you feel better than when you were on it, that should be your chiropractor, because there is that huge spectrum of just garbage industry. I mean, well, that person just touched you and now you're worse, or hopefully not worse, but at the very least, you're not better.
Yeah, no change at all.
Versus like, hey, this guy adjusted me and I felt way different and I feel much better about it and I'm going to tell my friend. Yeah.
Perfect. Awesome. So how can people find you? How can they follow you? How can they reach out to you to either ask questions or schedule a session?
Yeah, so for me, it's all drpearlmantv. One word all the way across, drpearlman, TV like television, and they will find me.
Awesome.
And we're Paramount Chiropractic and Wellness in Richardson, Texas. And if they follow all those, they'll be able to find me.
Awesome. Well, Dr. Pearlman, thank you so much for taking the time to do this. I'm glad you were able to come through, and I'm super pumped we got to do it in person.
Yeah.
I don't get to do that too much, especially now. So, thanks for being here. Thanks for taking the time to do it. And
sure, dude. Thank you for having me.
For sure, man.
I really appreciate you being here, and I really look forward. Literally, if not the end of next week, but hopefully the next 2 weeks, I want you on my podcast.
Awesome.
There's
Let's
so much
do it.
more deep diving we need to do.
Yes, for sure. Alrighty, y'all. Stay tuned for that. I'll let you know when we drop that episode, and stay tuned for next week's episode. Adios.